So now I'm going to show some more challenging exercises for the lower limb, which you can do if you've got problems in your ankles, knees or hips, which prevent you from weight bearing on the legs, which could be an ankle sprain, a knee break, or something which prevents you. All of these exercises must be done subject to not irritating any of the problems. For example, if you've been told by a doctor, do not move a joint, then don't move that joint. So these ones being more advanced with the understanding that you know how to be safely upside down. So the two positions that are most easiest to do this are the headstand and the shoulder stand, but I generally will not be encouraging someone to practice headstand or shoulder stand if they're injured unless headstand or shoulder stand was something that's already mastered properly and there's no neck conditions or upper back conditions that can be aggravated. So first I'll do the shoulder stand, and this is the easier one for most people. And so the shoulder stand can be done in its simplest form by lifting up into a half shoulder stand, and from this position I'm simply supporting the lower back. If you can't lift up like that, which is the ideal way, ideally you should be able to lift up into a shoulder stand, and my recommendation is if you can't, probably the shoulder stand is not suitable for you, or at least if you can't lift up like this, pressing the elbow down and lifting up. And this is a simple half shoulder stand. Here I'm resting on my upper back, not my neck. You can, of course, lift up higher, interlock the fingers, and then rest in a full shoulder stand like this. Now the shoulder stand, ideally, from this position, half or full shoulder stand, you can again circle the ankles and the knees and the hips, like I showed previously. And it can be done in flexion and extension. So now I'm circling either one or both legs, either individually or at the same time, and of course I do in both directions. The other things you can do with this, not just circling ankles, but also the hip positions. So I can take my legs wide apart, I can bring one leg forward, one leg back, I can twist a little bit and adduct the hips, bringing them inwards. So making a smooth transition like this is quite good. And bringing one leg down. When you bring the leg down, it's better to turn it outwards. With the leg in the air, turn it inwards. So the leg in the air, turn inwards, the leg toward the floor, turn outwards. And by pushing the legs apart, that will strengthen the front of the left hip and the back of the right hip. So whatever you do with these exercises, be very cautious for the neck. And by doing it in this position, you can start to, improve blood flow quite significantly. Okay. After the shoulder stand, it's good to release the neck, and one of the ways you can do this is just lifting the hips off the floor, but be careful if your feet can't take weight, and press the head into the floor, lift the throat and chin up. Make sure your neck is stable before doing the shoulder stand. Then, subject to being able to do this, you can do headstand as well. Come here. So the headstand, make sure you're safe to do this, can be done again with a sense that you're activating the legs. So often what I do in a headstand is let my legs fully relax, which releases the blood from the feet. And then once I've spent a short time with my legs relaxed, then I can start to do the exercises that I've shown already, including activating the leg muscles, flexion, extension of the ankles, and then inversion, turning the feet in and out, and then circle the ankles in both directions, bend and straighten the knees carefully, and then also the hips. Turn the thighs in and out, and in both directions. Once you start to move, it's a good idea to keep the arms quite strong. So you're taking at least, say, 60 to 80% of the weight on your arms. And then you can practice also taking the legs wide apart and bringing them closer. One leg forward, one leg back. And then once the stability is there, you can practice taking the legs to twist to one side and then bring them back the other way. So I'm flexing the right hip
then twisting the whole spine to the left. Then I flex the left hip and twist the whole spine to the right. And you can do this quite strongly with the leg muscles. You can keep your leg muscles quite strong if you wish, or you can let them be more relaxed. And here I'm actually tightening all the muscles around my hips and knees. But if you know you can't take weight on your legs, please be very careful when you're coming back down. So to come back down, I'm very careful. If it's only one leg that's damaged, say my left leg, I'll bring my right leg down first, very carefully, and bring the other leg down. This must be, of course, subject to being able to come down into a position like this. Generally, I would kneel fully and relax for a few moments, and then the releasing postures, generally I find most effective are to lift your throat up, head down, neck back, and do that in a number of positions. Ideally, I also do it in the dog pose, head up and down. Also, this position, head up, head down. Also in this position, head up and down, and also with the hands interlocked, head up and down. You could also do this if you can't be in a headstand comfortably. When you come down, just sit cross-legged or with the legs in front, and then practice from here, head up and down. It's actually throat forward, chin up, head down, neck back, and you can do that with the arms forward, throat forward, chin up, head down, neck back, or with the shoulders together. Throat forward, chin up, head down, neck back, and as the head lifts, make sure your abdomen lifts first. Okay, thank you.